Welcome to the A to Z cow farm. We have two very sick cows who need to be treated. These cows have very similar symptoms. First, the mucous membranes on their mouths and noses dried out. Then, they began to show signs of unsteadiness and extreme thirst. Their skin then lost its elasticity, and their urine output significantly decreased. Finally, they developed extremely high heart rates, low blood pressure, and intense peripheral vasoconstriction, or the narrowing of superficial veins and arteries. We concluded that these cows both suffer from hypovolemia, but for very different reasons. Hypovolemia is the decrease in volume of blood in your body, which can be due to blood loss or the loss of body fluids such as plasma. The first cow became hypovolemic rapidly due to a severe hemorrhage in the abdominal cavity. This means a large amount of blood escaped from a blood vessel in the abdominal area. The second cow became hypovolemic slowly due to dehydration. Both cows are now at risk for kidney failure, brain damage, heart attack, necrosis or death of tissues, organ failure, shock, or coma. In order to prevent these cows from these terrible fates, their blood volume and circulation must be restored.
Now, how can we respond to this problem? Of course, their owner could help by providing more water to drink or blood transfusions to increase the volume of the blood. But what do cows do? Enter rennin. This enzyme plays an important role in regulating blood pressure. Blood pressure is directly linked to the volume of the blood, but also the diameter of the arteries. A smaller diameter means greater pressure. Rennin is secreted by the kidneys in response to a decrease in blood pressure and therefore a decrease in blood volume. It activates other enzymes that increase the reabsorption of water in the kidneys. More water stays in the blood, and the problem is fixed. At least if it's not as severe as hypovolemia. The A to Z farm also makes cheese. Cheese is essentially solid, curdled milk. This happens when the enzyme rennin comes in contact with it. Rennin is produced by young ruminants in the lining of their abomasum, their fourth stomach. Rennin in the abomasum also curdles the milk they ingest. The milk then stays in the digestive tract longer compared to liquid, and the nutrients can be absorbed. So there is a difference between rennin and rennin. Rennin regulates blood pressure and blood volume, while rennin curdles milk in ruminants and makes cheese. Thank you for visiting our farm, and we hope you learned something.